Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us in studio again.
In this segment, he's focusing on the climbing number of measles cases in the U.S.
Yeah, and this continuation of the We've Become Smarter Than Science segment. We are now seeing what happens when we believe we need to stop doing some of the things that science says we need to do. And so it's true. The measles cases continue to rise across the United States with more than 2,260 confirmed cases reported so far this year in 44 states, including Kentucky. This represents almost the same confirmed cases through mid-July of 2026 as that of the entirety of 2025. One statistic stands out above all others, and that's 93% of the cases have occurred in people who were either unvaccinated or whose vaccination status was unknown, with 96% either unvaccinated or undervaccinated. Children have been affected the most, with half of all these cases occurring in those between 5 and 19 years of age, and another 20% in children under age 5. Although only about 6% of the patients have required hospitalization this year, measles remains one of the most contagious viruses that we deal with. A single infected person can spread the virus to up to 90% of susceptible people nearby. The good news is that the MMR vaccine remains about 97% effective after just 2 doses. Public health experts recommend ensuring children receive both routine doses and that adults at increased risk verify they are protected if you develop fever, cough, red eyes, followed by a rash, especially after a known exposure or travel. Contact your healthcare professional before arriving so that the appropriate precautions can be taken to prevent further spread. And the key here is on that last graphic right there. That's actually the vaccination rates, and as you can see, Kentucky in the dark reddish brown, we are actually one of the lower vaccination rates in the country, meaning we are less than 90% of our children are vaccinated against measles. Not surprising that we are actually seeing cases here in the Commonwealth. So, you know, this is one of those things where we reach below, they say the critical mass for herd immunity with measles is about 95 to 96% vaccination rate. So a little bit of work to do here, Kentucky. Make sure you get your kids vaccinated, because this is an illness that there is a reason we have a vaccine. It is dangerous. So we want to make sure we're protecting everybody.
Well, what do you say to those parents that are on the fence about the vaccine?
I would actually look at the real science, look at real evidence. When people come in and say, I've done my research, often that is not evidence or science-based research. There's a lot of sources out there. I like to use things such as open evidence, sources like that are actually large language models that are actually keyed towards real and true evidence. Get that information. You can look at the safety profiles versus what we've seen in the past with regard to these infections.
All right, great information as always, Doc. Great seeing you again.
Thank you. Appreciate it.
All right, we'll be right back.
Justin's up next.
You're watching Fox 56 News, our home, your news.